day everyone, this is Dorothy, and in this presentation I'll be talking about ear piercings. I've made this project so you know what to expect before getting an ear piercing, so you can make an informed decision. So, let's dive into this video, shall we? What are ear piercings? Ear piercings are body jewelry that are worn by people. It is a procedure where the piercer creates an opening in the ear and then inserts jewelry in the ear. Ear piercers typically use techniques such as a needle or a spring-loaded piercing gun. Here is a guide to ear piercings. Let's get into it. There are many types of ear piercings that you can get that are shown on the diagram. Pain levels and healing times will vary depending on where you get it pierced. We will look more into each one. Number 1 is the lobe. Lobes are the most common piercings people get and are also great for beginners. They are placed on the soft, fleshy lower part of the earlobe. Pain level is a 1 out of 10 and it will take 6 to 8 weeks for it to heal. Number 2 is the tragus. Tragus piercings are placed on the tiny flap of the ear canal. They take a long time to heal because the cartilage is thick on that part of the ear. Pain level is a 5 out of 10 and it will take 6 to 9 months for it to heal. Number 3 is the rook. Rook piercings are placed in the inner cartilage above the date and between the inner conch and the forward helix. The rook doesn't pierce as easily as the lobe because the cartilage is very thick and may feel a sharp pain and pressure once the piercer creates a hole in that area. 6 out of 10 for pain level and will take 3 to 10 months for it to heal. Number 4 is the date. Date piercings are found in the slight awkward position. It hugs around the cartilage on the inside of your ear. This piercing requires a skilled piercer. You'll feel dull pressure when you get it pierced because of how hard the cartilage is. 5 out of 10 for pain and it will take 6 to 9 months for it to heal. Number 5 is the forward helix. Forward helix piercings are placed on the upper ear above the tragus. They are a bit trickier than most other piercings as they must be lined perfectly with your ear. It will hurt more than the standard lobe piercing. Your piercer may use a needle or a machine depending how much skill your piercer has. 5 out of 10 for pain and it will take 6 to 9 months for it to heal. Number 6 is the industrial. An industrial piercing is a straight barbell piercing that connects one cartilage piercing to another of the upper ear. They are difficult to heal because of 2 cartilages being pierced all at once. They are also more likely to get irritated quickly and often stay that way. When you have an industrial piercing, be careful of your hair and glasses resting on your ear. It is not recommended that you sleep on it because it can cause pain and discomfort. 6 out of 10 for pain and will take 6 months to 1 year for it to heal. Number 7 is the helix. Helix piercings are located anywhere on the upper cartilage of the ear. They are often the first choice when moving from the lobe. It can be a bit more painful than the standard lobe. 4 out of 10 for pain and it will take 6 months to 1 year for it to heal. Number 8 is the conch. The conch is located in the middle portion of your ear cartilage and gets its name from its resemblance to the spiral shell of the same name. It's pretty versatile and can be pierced with a stud for a subtle effect, a double stud if you're feeling brave, or even a cuff that can hug its way around the edge of your ear. 4 out of 10 for pain and it will take 3 to 9 months for it to heal. Number 9 is the snug. Snugs are pierced horizontally through the inner rim of cartilage above the antitragus. It is also referred as an anti-helix piercing and is considered to be the most painful of cartilage piercings. 9 out of 10 for pain, and it will take 4 to 6 months for it to heal. Number 10 is the orbital. Orbital piercings are usually located in the helix region of the ear and can be done anywhere on the body, including the earlobes. Similar to an industrial piercing, however, an orbital is pierced with a ring rather than a barbell. It gives an illusion that the piercing is orbiting around the ear. 4 out of 10 for pain, and it will take 8 to 10 weeks for it to heal. Number 11 is the antitragus. Antitragus piercings sit directly from the opposite tragus hump above the earlobe. Depending on the shape of your ear, piercers may perform the procedure a bit differently than most piercings. The best options for this piercing are curved barbells or ball closer rings. 6 out of 10 for pain, and it will take 9 months to 1 year for it to heal. Number 12 is the transverse lobe. With a transverse lobe piercing, the jewelry is threaded from side to side rather than front to back as with traditional piercings. They are usually done with a barbell, which will result in 2 balls appearing on either side of your lobe. 6 out of 10 for pain, and it will take 2 to 10 months for it to heal. Now we will talk about whether you should get your ears pierced with a needle or with a piercing gun. Let's find out which one is better. Piercers usually use needles or spring-loaded piercing guns to create an opening in the ear. As we look more into them, we will determine which one works best for those who are new or have had their ears pierced before. What is a piercing needle? It is a traditional method where a professional piercer uses a hollow, single-use needle to create a clean hole for the jewelry to be inserted. The needle is specifically designed to minimize tissue damage and to promote better healing. Now we are going to talk about the pros and cons of getting your ears pierced with a needle. The pros are precision and control. Needles are sharp and create a clean, precise hole that minimizes tissue damage. This leads to a smoother healing process with less pain and swelling. Sterility. Needles used in professional piercing studios are single-used, pre-packaged, and sterilized. The entire procedure is carried out under strict hygiene protocols, significantly reducing the risk of infection. Pain level. They tend to be less painful because the process is more controlled and the needle is sharper, allowing it to glide through the tissue with less resistance. Healing time. With less tissue damage, needle piercings generally heal faster and with fewer complications. Customizable jewelry. When choosing a needle, you can choose a wide variety of jewelry options in terms of material, size, and design, ensuring a better fit and less irritation during the process. And for the cons, there are not many, is the cost. Needle piercings can be expensive because they are usually done by piercers in professional piercing studios. That is all for the pros and cons of getting your ears pierced with a needle. What is a piercing gun? A piercing gun is a handheld device designed to quickly insert a piercing stud through the earlobe or other body parts. The gun uses a spring-loaded mechanism to push the earring through the skin in one swift motion. Now we are going to talk about the pros and cons of getting your ears pierced with a piercing gun. So here we go. For the pros, they cost low. Piercing guns are usually inexpensive, making them a popular choice at malls and jewelry stores. Convenience. They are widely available and can be found anywhere like online, at stores, in person, etc., making it easier to get a piercing on a whim. And for the cons, the pain level. The piercing gun's quick action can cause a sharp, intense pain as the jewelry is forced through the skin. The blunt force can also result in prolonged soreness and bruising. Healing time. Due to the trauma inflicted by the gun, the healing process can be longer and can lead to complications like keloids, infections, or misalignment of the piercing. No custom sizing. Piercing guns can only accommodate one size of jewelry, and unfortunately, one size does not fit all. And sterility issues. While some piercing guns use disposable parts, the main part of the gun is often reused, which raises concerns about cross-contamination and infections. Even with cleaning, it's difficult to ensure complete sterility. That is all for the pros and cons of getting your ears pierced with a piercing gun. So, needle or piercing gun, which is better? Overall, needle piercings are the best option in terms of safety, precision, and overall healing experience. While piercing guns seem more convenient and less expensive, the potential risks to your health and the quality of your piercing far outweigh the benefits. Always choose a professional piercer who uses a needle and practices strict protocols. Now we are going to talk about how to take care of a new ear piercing. So, no matter which piercing method you choose, afterwards you need to take care of your new piercings to prevent any issues from occurring. How should I clean my piercing? 1. Prior to cleaning your new piercing, thoroughly wash your hands. Other than to clean your piercing, avoid touching it as much as possible. Do not rotate or twist. 2. Spray the front and back of your piercing with sterile saline solution 2 to 3 times a day. For certain piercings, it may be easier to apply using a clean, non-woven gauze saturated with a saline solution. If your piercer suggests using soap, gently lather around the piercing and rinse as needed. Avoid using harsh soaps or soaps with dyes or fragrances. 3. Rinse the pierced sides, front and back, and surrounding area with water as needed to remove cleaning solution residue. Moving or rotating jewelry is not necessary during cleaning or rinsing. 4. Dry the area by gently patting with clean, disposable paper products. Cloth towels can harbor bacteria and snag on jewelry, causing injury. Here are some pro tips. Do not use cotton swabs or pads as the fibers can get caught under your jewelry and irritate your piercing. We recommend using non-woven gauze or spraying saline directly onto the front and back of your piercing. Make sure your bedding is washed and changed regularly. Wear clean, comfortable, breathing clothing that protects your piercing while you are sleeping. Try your best to avoid sleeping directly on your fresh piercing. Pro tip. Use a travel pillow and place your ear in the middle hole of the pillow when laying down your side. Stay dry. Avoid submerging your new piercing in water such as pools, baths, and oceans. Showering is fine. Just remember to keep your piercing clean and rinse thoroughly of any residual soap. Now we are going to talk about what is the best metal for piercings. So here we go. Here's something that most people don't know about ear piercings. There are many types of metals that can be used. Before you add more earrings to your collection, be aware of what ingredients your earrings may have, because some metals may not be safe for your skin. We are going to look more into it. The best metals that are actually safe for your skin. Number 1 is titanium. Titanium is considered to be the best metal for piercings. It's lightweight, durable, and it's also hypoallergenic, so it's less likely to cause allergic reactions. Titanium is nickel-free, and the best part is, it comes in many colors, so you can accessorize however you like. The only downside for this metal is that it can be expensive. Look for implant-grade titanium with designations like ASTM F-136, 𝚘𝚔-F-67 or ISO 58332-3. Number 2 is 14K or 18K gold. Gold is also a great option for piercings. Carats measure the amount of pure gold in the alloy. This metal will not rust or tarnish. It is also easy to decorate and shape. One downside is that it is expensive, but another concern is that the metal is soft, making it susceptible to bends, breaks, and even gouges. It can also be heavy, especially with more pure carat ratings. Number 3 is steel. Steel combines iron and carbon, improving its strength and ability to resist fracturing. However, even surgical grade steel may contain some nickel, although it is considered hypoallergenic for most people. Make sure to buy surgical grade steel jewelry. These will have ratings 316L, ASTM F-138, ISO 58332-1, ISO 10993-6, ISO 10993-10, or ISO 10993-11. One of the advantages is that it is affordable. It is also a durable option. A disadvantage is it can be less comfortable if worn for long periods of time. Number 4 is platinum. Platinum is a silver white metal known for its corrosion resistance. This metal has a density that makes it more durable than other metals like gold or silver. It will not tarnish or discolor over time. Platinum is a lot heavier than other metals. Another disadvantage is that it is really expensive because it is several times more rare than gold. Number 5 is niobium. Niobium is a light gray metal known for its hardness that is like titanium. It is also corrosion and tarnish resistance. It might be the best metal for piercings if you want titanium-like durability with more malleability. It can also come in a variety of colors, so you can accessorize however you like. Now we are going to talk about which metals to avoid in your piercings. So here we go. Number 1 is nickel. Nickel is often used with alloy mixtures. It is used in many recognizable industrial and consumer products, including stainless steel, magnets, coinage, rechargeable batteries, electric guitar strings, microphone capsules, plating on plumbing fixtures, and special alloys such as permalloy, Elivar, and Invar. It is also used for plating and as a green tint in glass. Unfortunately, it is also something that many people develop an allergic reaction to after they were born. Most people are unaware that they are allergic until a reaction occurs. This makes nickel-free alloys like titanium the best metal for piercings for those with allergies. Number 2 is brass. Brass is another metal to avoid when possible. It can also cause allergic reactions that include skin irritation through piercing rejections. If you have sensitive skin, avoid this copper and zinc alloy and go for one of the options listed in previous slides 30 to 34. Number 3 is sterling silver. Sterling silver is a potential carrier of unwanted bacteria. The metal is soft, making it easier to scratch. Those scratches, in turn, make a perfect hiding place to bacteria that could cause infections. Most people only use this metal in fully healed piercings at best. Number 4 is plated metals. Plated metals are alluring as a cost-effective alternative, but avoid using them in your jewelry. The plated surface metal will flake over time, exposing the cheap metals below the surface. That creates ridges for bacteria to rest, and the cheaper metals may cause allergic reactions. Number 5 is magnetic metals. Lower grade metals like iron and even some steel jewelry pieces are magnetic. Magnetic metals may not be as biocompatible as materials designed for body jewelry. Nickel is commonly found in magnetic metals. While some ferrous metals purport healing effects, there is limited scientific evidence to support these claims. In fact, non-ferrous metals, including certain surgical steels, tend to be more hypoallergenic. You may also have to remove them when going through scanning equipment. Thank you for watching and listening to this presentation. If you have any more questions about ear piercings or this slideshow, then feel free to ask.